In this video, I want to talk about humans being weird. And the particular way that I want to talk about humans being weird is through placebos. When researchers are trying to figure out if a drug works, they compare the drug that they're measuring versus a placebo, which is something that they know is not actually going to make a difference. Placebos are sometimes called sham interventions for this reason. They don't actually have any therapeutic benefit. But if this is the case, if they don't actually help in any way, then that must mean that it's wrong for doctors to use placebos in treatment, right? Right? But the way that humans are weird is something called the placebo effect. Even when you give somebody an inert substance like a sugar pill that doesn't have anything to do with the condition that they have, they will have a response to it. And this is just something that our brains do. When you think that something is going to work, then it can sometimes work a little bit. A Cochrane review, which compiles a bunch of different studies, found that the placebo effect is most effective for pain, nausea, asthma, and phobias. But it's also been found to work in other sorts of cases, including surgeries. So one study found that sham surgeries are effective in treating knee osteoarthritis and degenerative meniscus tears. It also matters how the placebo is administered. So a study found that if you give patients a saline injection versus giving them a pill, that the injection causes a better response, even though it's just saline. It doesn't actually do anything to help the underlying condition. Weirdest of all, placebos can help even when the person knows that it's a placebo. This is what's called an open label placebo. The doctor says, hey, here's a placebo. If you take this, it doesn't have a therapeutic benefit. And then patients still sometimes report feeling better. That's very weird. Given all this, it's not really accurate to say that the placebo effect makes no difference at all. If you give somebody a placebo and it helps relieve their pain, for instance, then that is a genuine benefit. But still, many people say that placebos shouldn't really count as treatment because they're not actually helping in the right sort of way. So to consider this, I give you the placebo's evil twin, the nocebo. The nocebo effect is the opposite of the placebo effect. When you give somebody a placebo, it makes them better off in some way, such as relieving their pain. But the nocebo effect works in the opposite direction. You give them something that's inert, and it causes them to be worse off. So one study looked at this by having people with asthma come into a lab, and they told the subjects that they were going to breathe this air, and it was a special air that was known to cause asthma attacks in people with asthma. And when they breathed the air, some number of people actually did have an asthma attack. But it was just plain air. So one of the lessons here is that you can't really trust anybody. But the other lesson is that you can't really reject the nocebo effect as not really causing actual harm or not really making people worse off. If one of those researchers did it maliciously and said, oh, I didn't actually hurt anybody, I just gave them normal air, the response would be, yeah, but you had the intention to harm them, and you actually did harm them. You caused them to have an asthma attack. So if we think that nocebos are real, can be real cases of harm, then the other side of that is that placebos can be real cases of benefit. So does that mean that doctors should be handing out placebos all the time? Not so fast. So imagine somebody who has some condition and they're seeking relief from it. Now, if you give them a placebo, it might help by, for instance, relieving their pain. But it's true that the placebo isn't really going to treat the underlying condition. The placebo is not going to lower your cholesterol or solve whatever underlying problem you have. And so you can think of the placebo effect as compared to a baseline. If the person just didn't go to the doctor at all, then they would stay at the same level of well-being or of health. But if you give them the placebo, then the placebo effect will bump them up a bit. They will report getting a bit better. But if there is something even more that can help them, like an actual treatment, a treatment that addresses their underlying condition, then that is the right thing to give the person. What doctors should be trying to do is help patients as much as possible. So in a case where there's something better than a placebo, you should give the thing that's better than the placebo. But suppose somebody has a medical condition and it's diagnosed and they've tried all the treatments that are available and the person is still not getting better and is still not having relief from their symptoms. In this kind of case, you could imagine it being appropriate for the doctor to try prescribing a placebo. to say, well, we've tried all the other things and they're not working, and so given that we're out of options, maybe a placebo is worth a go. One of the benefits of a placebo is that the likelihood of side effects is lower than with a different kind of therapeutic approach. So any other kind of medication might have more serious side effects. But a placebo, unless there's kind of like some suggestion of having a nocebo effect, then the placebo is not likely to have as many downsides. So that's a positive. So in those cases, if the placebo is the best that the doctor can do, then it might still be worthwhile to offer that. A concern that people have about this, though, is that it's deceptive. So if you're not actually giving a real therapy, then it would be, people think that it's wrong to lie to patients, to give them a placebo when the patient thinks that they're going to get some kind of like actual drug. And this can be true, so it's worth digging into it a little bit more. One response that we could make to this is that it just depends on what the framing is. If the doctor says, hey, here's this pill, I know we've tried a lot of other stuff, but a lot of my patients who tried this actually do seem to report having some benefit, so give it a go and see for yourself. Now, that's not actually saying anything false if you give a placebo in that case. That might be totally acceptable. And so it depends what you think informed consent requires. If it requires actually naming the drug, like here is the name of this drug, then the placebo is not going to do it because it would just be like a sugar pill. But if it requires saying, here are the likely side effects, here's the likely benefit, here are the pros and cons, then giving a placebo in that way, even without saying that it's a placebo, that might be totally fine. The other option is that you can go one step further and to disclosure by using an open label placebo. Tell the patient, this is a placebo. We've tried the other options, but the placebo effect is real. Give it a go and see if you benefit. And then if the patient wants to try it, then there's not really any kind of downside in terms of informed consent that way. So given all of this, we can't really conclude that a placebo is always ethical to use or is always wrong to use. It's going to depend on the circumstances. But one thing that I think is an important takeaway is that doctors use placebos in lots of ways without really thinking of them as placebos. So when doctors put on their white coats and put a stethoscope around their neck, then that has an effect on patients, that patients report feeling better seeing a doctor, even if the doctor doesn't do anything, even if the doctor doesn't prescribe a medication or any other kind of intervention. So this is the sort of thing that if it can help patients feel better, then it's appropriate for doctors to do it. Putting on a white coat doesn't make anybody worse off, but if it helps people feel better, then that's great. And if that works better than a doctor wearing like a different kind of shirt or a different kind of jacket, then go with the white coat, no problem. The main takeaway is that since humans are weird, we shouldn't avoid that weirdness in all cases. We can lean into the weirdness in some situations, and that can actually help.